Seniors, you've been told turmeric is a miracle spice. But what if I told you that combining it with the wrong foods could actually hurt you? That's right, turmeric isn't always safe. In fact, when eaten with these 6 everyday foods, it can trigger dangerous side effects, from blood pressure crashes to stomach issues and more. In this video, we're diving into the science and the hidden interactions your doctor might not have warned you about. If you're over 60 and take turmeric, even just occasionally, you need to hear this. Stick around. Number 3 is a shocking one most people eat every day. 1. Dairy products, milk, cheese, yogurt. While it might seem natural to pair turmeric with milk, after all, golden milk is a trendy health drink, seniors should be cautious. Dairy contains casein and calcium, both of which can interfere with the body's ability to absorb curcumin, the active compound in turmeric. This reduces the bioavailability of turmeric's benefits, essentially making it less effective. But beyond neutralizing turmeric's powers, dairy products can also pose digestive issues for older adults when combined with the spice. Many seniors already experience reduced lactase production as they age, making them more susceptible to bloating, cramping, and discomfort when consuming dairy. When turmeric is added to the mix, its strong compounds can irritate the digestive tract further, leading to nausea or acid reflux, especially if the meal is rich or high-fat. In addition, turmeric acts as a mild blood thinner, which is often considered beneficial for preventing clotting issues. However, when combined with dairy, particularly aged cheeses that contain tyramine, it may increase blood pressure unexpectedly. Tyramine can constrict blood vessels, and when paired with turmeric's blood-thinning effect, the combination may put undue stress on the cardiovascular system. For seniors with hypertension or those on medication like warfarin or aspirin, this can become a serious issue. Moreover, the saturated fats in dairy can also hinder the liver's ability to metabolize curcumin effectively, potentially causing hormonal imbalances or liver strain over time. Seniors trying to manage cholesterol levels should especially take heed. Another key concern is the possibility of allergic reactions or food intolerances. While turmeric rarely causes allergies on its own, combining it with milk or other dairy products might trigger or exacerbate mild allergic responses, such as skin rashes, itchiness, or sinus congestion. Seniors with known sensitivities should particularly avoid combining the two, as immune response weakens with age, and a mild reaction can escalate into something more serious. Additionally, the gut microbiome plays a vital role in senior health, and while both turmeric and probiotics in yogurt can be beneficial separately, together they may disrupt gut flora balance due to incompatible enzymatic reactions. Especially in those with pre-existing gastrointestinal disorders. Lastly, there's the issue of nutrient absorption. Turmeric enhances the bioavailability of certain nutrients like iron, but when taken with calcium-rich foods such as milk or cheese, it may actually block iron absorption. This is particularly concerning for elderly individuals at risk of anemia. If consumed frequently, this combination can gradually deplete iron stores in the body, leading to fatigue, muscle weakness, and impaired cognitive function. Seniors trying to boost their vitality with turmeric might find themselves unknowingly undercutting its benefits with everyday dairy. The best approach is to take turmeric separately, possibly with a source of healthy fat like coconut oil or black pepper, which increases curcumin absorption, instead of combining it with milk-based meals or drinks. 2. Cruciferous vegetables, broccoli, cabbage, kale, Brussels sprouts. Cruciferous vegetables like broccoli, kale, cabbage, and Brussels sprouts are often celebrated as superfoods, and rightfully so. They contain cancer-fighting compounds like sulforaphane, are rich in fiber, and offer a host of vitamins that are vital for aging bodies. However, combining them with turmeric might not be the best move for seniors. One of the lesser-known issues is that these vegetables are high in goitrogens, compounds that can interfere with thyroid function when consumed in large amounts. Turmeric also has a tendency to affect hormonal levels, especially if taken as a supplement. When both are consumed together frequently, they may amplify the suppression of thyroid hormone production, potentially leading to hypothyroidism in vulnerable individuals. For seniors, especially women over 60, thyroid function is already at a higher risk of decline due to age-related hormonal changes. Hypothyroidism can cause fatigue, weight gain, and depression, all symptoms that might be misattributed to aging itself. Adding turmeric into a diet already rich in cruciferous vegetables could quietly exacerbate these symptoms. Additionally, cruciferous vegetables are also known to cause gas and bloating due to their high sulfur content. Turmeric, while sometimes used to ease digestion, can become an irritant in this context. The digestive system in seniors becomes more sensitive over time, and the potent compounds in turmeric combined with the fermentable fibers in cruciferous vegetables can lead to excessive discomfort, especially when the two are eaten raw or undercooked. Moreover, both turmeric and cruciferous vegetables influence liver enzymes. While this can be beneficial in moderation, overactivation of liver detox pathways can lead to unintended consequences. The liver might metabolize medications too quickly, rendering treatments for conditions like diabetes, high blood pressure, or cholesterol less effective. Seniors who are often on multiple medications, polypharmacy, must be particularly cautious of this interaction. Turmeric enhances liver activity, and when paired with the detoxifying effects of cruciferous vegetables, it could result in poor drug efficacy or even toxic buildup if medications are flushed out too rapidly. There's also the matter of mineral interaction. Cruciferous vegetables are high in potassium and vitamin K, both of which play roles in cardiovascular health and blood clotting. When combined with turmeric's blood-thinning and potassium-modulating effects, seniors might unknowingly place themselves at higher risk for arrhythmias or clotting disorders. For example, too much vitamin K can counteract the effects of blood thinners, while turmeric might enhance them. This creates a dangerous push-pull dynamic that can cause instability in blood consistency and circulation. Therefore, while each food is healthy on its own, their combined consumption should be carefully moderated, especially in the elderly. 3 citrus fruits, oranges, grapefruits, lemons, citrus fruits, beloved for their refreshing taste and high vitamin C content, seem like the perfect health food for seniors. They support immune health, promote hydration, and offer antioxidant protection against aging. However, when citrus fruits are consumed alongside turmeric, the interaction can create health challenges. The first and perhaps most serious concern is how grapefruit, in particular, interferes with liver enzymes that metabolize drugs. This is especially problematic when combined with turmeric, which also influences these same enzymes, notably CYP3A4. Seniors who are on statins, blood pressure meds, or antidepressants may experience increased blood levels of these drugs, leading to toxic side effects, simply from combining grapefruit and turmeric regularly. Furthermore, citrus fruits, being acidic, can interact negatively with turmeric's bioactive compounds in the digestive tract. For seniors with sensitive stomachs or GERD, gastroesophageal reflux disease, this combination can aggravate symptoms. The acidity of citrus combined with the spiciness of turmeric can inflame the esophageal lining, causing heartburn, indigestion, or nausea. While turmeric is sometimes marketed as a digestive aid, its effects are highly context-dependent. In this acidic environment, it can act more like a stimulant than a soother, especially in elderly individuals with compromised mucosal barriers in the gut. Citrus fruits are also high in flavonoids, which can interfere with turmeric's function at a molecular level. For example, naringenin, found in oranges and grapefruit, can alter how turmeric is metabolized in the liver. Rather than enhancing turmeric's anti-inflammatory effects, the interaction may suppress or misdirect them, resulting in reduced efficacy or unexpected side effects. In some cases, this might show up as allergic reactions or skin sensitivities, particularly for those using turmeric topically or in supplement form alongside a citrus-rich diet. These biochemical clashes may go unnoticed at first but can accumulate over time, leading to systemic inflammation or oxidative stress, the very issues turmeric is supposed to combat. Finally, there's the blood-sugar connection. Citrus fruits, especially in juice form, can cause blood sugar spikes due to their natural sugars. When paired with turmeric, which also influences blood glucose levels by increasing insulin sensitivity, seniors with diabetes or insulin resistance may experience unpredictable drops or surges in blood sugar. This becomes especially risky if they are taking medication for glucose regulation, as the interaction can amplify or counteract the effects, leading to dizziness, fatigue, or even fainting spells. It's crucial for seniors to monitor not only what they eat, but also how combinations of healthy foods like turmeric and citrus might interact and impact their metabolic balance. For leafy greens high in vitamin K, spinach, Swiss chard, collard greens, leafy greens like spinach, Swiss chard, and collard greens are nutritional powerhouses. They're rich in iron, folate, antioxidants, and most notably, vitamin K, a crucial nutrient for blood clotting and bone health. For seniors, these vegetables are often recommended to maintain strong bones and prevent age-related degeneration. However, when consumed alongside turmeric, they can create problematic interactions that might go unnoticed until symptoms appear. Turmeric naturally has blood-thinning properties due to its curcumin content. While this can help reduce inflammation and prevent clot formation, it can become risky when paired with large amounts of vitamin K, which promotes blood clotting. This antagonistic relationship can lead to unpredictable effects on coagulation, making it difficult to maintain proper blood consistency, especially for seniors on blood thinners like warfarin. This conflict becomes particularly concerning because many seniors are prescribed medications that rely on stable vitamin K intake. When turmeric is added to the mix, it can disrupt that stability. For example, a person trying to eat healthily with a spinach salad and turmeric dressing might unknowingly create internal chaos. The spinach boosts clotting factors, while the turmeric suppresses them. The result can be either excessive bleeding or unwanted clotting, depending on how the body reacts. Worse still, changes in clotting time don't show obvious symptoms until a serious problem occurs, like a bruising episode, a stroke, or gastrointestinal bleeding. For elderly individuals who already have fragile blood vessels or compromised liver function, this kind of internal imbalance can quickly escalate into a medical emergency. Moreover, leafy greens contain oxalates, naturally occurring compounds that can bind to minerals like calcium and iron, forming insoluble crystals. When turmeric is consumed with these vegetables, it can increase the risk of kidney stone formation, particularly calcium oxalate stones. This is due to turmeric's relatively high oxalate content as well. While one serving of either food on its own is unlikely to cause harm, regular combination of the two, especially in smoothies or health bowls, can lead to a buildup of oxalates in the kidneys. Seniors with a history of kidney stones or reduced kidney function are particularly vulnerable to this effect. Even if stones don't form, this combination may put unnecessary strain on the kidneys, contributing to dehydration, urinary discomfort, or long-term nephrotoxicity. The last point of concern is iron absorption. Spinach and other leafy greens are often touted as good sources of iron, but most of that iron is non-heme, which the body has a harder time absorbing. Turmeric can further inhibit non-heme iron absorption, particularly if consumed without a cofactor like vitamin C. Seniors who are borderline anemic or suffer from chronic fatigue may find that despite eating an iron-rich diet, they feel no better. This is often because turmeric's chelating properties bind minerals like iron and make them unavailable for absorption. This effect can go unnoticed for months, slowly sapping energy, mental clarity, and physical resilience. To prevent this, it's wise for seniors to separate turmeric intake from iron-rich plant meals by at least a few hours or consult a nutritionist to tailor their supplement schedule. 5. Garlic and onions. Garlic and onions are staples in many diets and are frequently praised for their anti-inflammatory, antibacterial, and heart protective properties. Like turmeric, they support cardiovascular health and immune resilience, which makes them seem like a perfect pairing. However, seniors should be careful when combining these pungent foods with turmeric, especially in large quantities or on a daily basis. One major concern is the cumulative blood-thinning effect. Garlic, especially in raw form, is a natural anticoagulant. When combined with turmeric, which also prevents clot formation, the duo can significantly increase the risk of internal bleeding or bruising, especially for seniors on anticoagulant medication or those preparing for surgery. Even minor cuts or dental procedures may result in excessive bleeding due to this interaction. this effect is compounded by the fact that many seniors use garlic supplements, aged garlic extract, or even raw garlic cloves as part of their health routine. While this can be beneficial in isolation, pairing it with turmeric tea, golden milk, or turmeric capsules may push the body's clotting response into dangerous territory. Signs of an overly thin blood system might include frequent nosebleeds, blood in the urine or stool, or unexplained fatigue due to microscopic internal bleeding. These signs are easy to miss or attribute to other conditions, which makes the garlic-turmeric combination particularly insidious. For seniors with a history of ulcers, gastrointestinal bleeding, or those on aspirin therapy, this pairing should be approached with extreme caution. Beyond blood thinning, there's also the digestive aspect to consider. Both garlic and turmeric are potent and can irritate the gastrointestinal tract, especially when consumed in raw or concentrated forms. Garlic is known to relax the lower esophageal sphincter, which can worsen acid reflux. Turmeric, while anti-inflammatory in theory, can sometimes cause stomach upset or nausea in sensitive individuals. For older adults with GERD, ulcers, or irritable bowel syndrome, this combination may lead to more discomfort than relief. Meals rich in spices like turmeric and garlic may sound like a flavorful idea, but they can produce excessive stomach acid, bloating, and even diarrhea in seniors with slower digestion or weakened gut lining. Additionally, garlic and onions are high in fructans, a type of carbohydrate that can cause digestive distress in those with FODMAP sensitivities. When paired with turmeric, the result can be a triple whammy of digestive distress, bloating from fructans, acid reflux from garlic sphincter relaxation, and mild inflammation from turmeric's pungency. Seniors with compromised digestion or those who've had gallbladder issues, as turmeric stimulates bile production, should be particularly wary. While all three foods, garlic, onions, and turmeric, are health-promoting on their own, they can become a source of discomfort or even harm when combined, especially for aging bodies that process nutrients and compounds more slowly. 6. Nuts and seeds, especially almonds, flax seeds, and chia seeds. Nuts and seeds are often considered staples in a healthy senior diet due to their high levels of omega-3s, fiber, and plant-based protein. Almonds, flax seeds, and chia seeds in particular have become popular additions to smoothies, yogurts, and health bowls. However, when consumed together with turmeric, this combo can lead to unintended consequences for older adults. First, it's important to understand that many nuts and seeds, especially flax and chia, contain high levels of alpha-linolenic acid, ALA, which acts as a blood thinner. When turmeric is consumed alongside these foods, it can lead to compounded anticoagulant effects. Seniors with even slight platelet dysfunction or those on any form of anticoagulant medication are at heightened risk of prolonged bleeding, especially from minor injuries or medical procedures. The danger increases when turmeric supplements are used instead of culinary doses. Supplements typically contain high concentrations of curcumin, far more than what you'd get from cooking. When a smoothie contains flaxseed, chia, and a spoonful of turmeric powder or capsule content, the risk of spontaneous bleeding or bruising can spike dramatically. This is particularly concerning for seniors who take such smoothies in the morning along with medications like Plavix, warfarin, or aspirin. Additionally, nuts and seeds tend to be high in omega-6 fatty acids as well, which, when imbalanced with omega-3s, can increase systemic inflammation. Turmeric is often used to counter inflammation, but paradoxically, the imbalance caused by these fatty acids may reduce its effectiveness or even trigger inflammatory responses in certain individuals. Another issue lies in nutrient absorption. Turmeric requires fat for optimal absorption, and while nuts and seeds do contain fat, the presence of high amounts of fiber in these foods can interfere with that absorption. Soluble fiber can bind with curcumin in the digestive tract, preventing it from entering the bloodstream. While seniors may assume they're getting a health boost from their morning chia turmeric parfait, they might not be absorbing much of the turmeric at all. Worse, the bound curcumin fiber complex can act as an irritant in the gut, potentially causing mild diarrhea or cramping, especially in older individuals with sensitive digestion. For those already experiencing constipation or irregular bowel movements, this interaction can throw gut health even further off balance, Lastly, there's the risk of allergic reactions and food sensitivities. Nuts are one of the most common allergens, and while most reactions are identified earlier in life, sensitivities can develop with age due to changes in gut permeability and immune function. Turmeric, although rarely allergenic, can intensify immune responses when consumed with an allergen. This means that a mild almond sensitivity might become a full-blown allergic episode when combined with turmeric. Symptoms may range from hives to difficulty breathing. Seniors with autoimmune disorders or compromised immunity should especially be aware of this potential synergy. While nuts, seeds, and turmeric are often featured together in health-focused recipes, it's crucial for the elderly to consider how their bodies metabolize these combinations, and whether they're doing more harm than good.